In the previous video, we talked about creams, and in this video, we're going to talk about pastes. So, what are pastes? They are semi-solid preparations containing a high percentage of finely divided active constituent in a suitable base. And a requirement for all pastes is that they contain at least 50% solid content. And since the majority of our paste will contain solid content, they are stiff. They remain in place after application to the skin and hence are unsuitable for application to hairy areas, just like ointments. What do we use pastes for? We use them primarily to absorb discharges from sites of oozing. Like in weeping eczema, they absorb the discharges which are released. And this is the consistency of our paste. In some cases, we can use pastes as anti-inflammatory agents. How? We can incorporate an active constituent which is irritating, like methyl salicylate or capsicum, into the paste, so that when applied to the skin, the paste increases skin irritation. At this point, you would be asking, why would we want to irritate the skin? And why do we need to apply the paste to the skin while it's hot? Well, because by irritating the skin and heating the paste, we would increase the blood supply to the site of application. If the blood supply increases, that means that the white blood cells also increases at the site, therefore inducing an immune response against the bacteria present in the lesions of the skin. The bacteria are attacked, killed, and released in the form of toxins that appear as discharges, as we can see in the diagram here. The final step is to take away or absorb these discharges from the skin. And if we are dealing with a bald area like this diagram shows, then the paste does the perfect job. But if we are dealing with a hairy area, then we wouldn't be able to apply the paste in the first place. So we would use gels instead. In this way, we can ensure that the preparation is efficient and also to satisfy patient compliance, since no one wants to deal with the aftermath of applying a thick, sticky preparation on hairy areas. Most of the time, though, we use poultice pastes in the treatment of boils and carbuncles. And the reason why is because poultices gather all the bacterial toxins in a concentrated area and eliminates them. And they are preferred over antibiotics because antibiotics simply weaken the bacteria. So if the bacteria develop antibiotic resistance over time, recurrent infections occur and hence antibiotics don't solve the problem. This is the poultice when it's prepared, and this is the carbuncle in question to treat. If we were to compare between ointments and pastes, then we can establish a table of comparison like this. Pastes are more stiff, more thick, and less greasy than ointments. They have a greater protective power as they adhere and remain in place on the skin. They soothe inflamed surfaces and they minimize damage done by scratching. They also have a high absorptive power as they remain in place with little tendency to soften, and actually, when we apply paste to the skin, they stiffen over time, so they absorb secretions from the site of application. We use ointments for treatment of dry skin when we couple them with hydrating agents. However, with pastes, we usually target acute lesions like crusting and oozing, and usually we are treating oozing. Both ointments and pastes cannot be applied to hairy regions of the skin. There are two types of pastes, fatty pastes and jelly pastes. Let's begin with fatty pastes. Fatty pastes are ointment-like pastes and they have a thick, fatty base. If we wanted to prepare a paste from an ointment, we would simply add the finely divided active constituent, again ensuring that it constitutes at least half of the overall preparation, because if it doesn't, then it is not considered a paste. We use fatty pastes as a protective coating as they do not flow at body temperature and they retain secretions inside wounds since they are fatty. We can incorporate many active constituents into them like salicylic acid, resveratrol, eugenol, and zinc oxide. Notice that all of these active constituents are antiseptics. Salicylic acid is also a keratolytic, resveratrol a disinfectant, eugenol an anesthetic, and zinc oxide is a mild astringent antiseptic. On to jelly pastes. They are water-soluble pastes and therefore they are miscible with aqueous fluids that are secreted from skin lesions and are easily removable from the skin and wounds. There are 3 different types of jelly pastes depending on the type of base we use. We can use either gelatin base, starch base, or tragacanth base. If we wanted to prepare jelly pastes, then there are some precautions that we should consider. We know that to form a paste, we need a base and the active constituent. And we established that our base can either be gelatin, starch, or tragacanth. And by the way, all of them are initially found as powders. Jelly pastes are water-soluble, so they also need to have water content in them, and therefore we add water as well. So basically, we should add water to the base to give us our paste, right? Not quite. We found that when we add water directly to the base, for example tragacanth, a lumpy product forms instead of a paste. Why? Because only the surface particles of the base are wetted, and they cover the rest of the particles deep below from being wetted, and hence they form lumps. What is the solution to this? The solution is to add a distributive agent such as alcohol or glycerine, as both will guarantee that all particles are wetted, and then once we form our paste, we can add water onto it to form our jelly paste. And with that, we've finished paste.